Is weight training with spinal stenosis safe? Spinal stenosis is a spinal condition that causes narrowing of the spinal canal and potentially the holes that exit from the spine that encase the nerves and the spinal cord. Now, the spinal canal, like I mentioned, it houses the spinal cord, which is a bundle of nerve that branches into the body. Spinal stenosis typically occurs for one of two reasons: as a result of degeneration to the different areas of the spine, like discs or bones, or as a result of alignment throughout the spine that causes the space to decrease between one bone and another. Now, the effects of spinal stenosis really depend on what areas are being affected. When there's less room in the spinal canal, it means that these nerves potentially could be compressed. And it can happen anywhere in the spine. It can happen in the neck, it can happen in the mid-back, it can happen in the low back. So wherever the areas that are being compressed are typically the areas that you may have the affected symptoms. So this can include back pain, radiating pain, strain sensations like burning and tingling and numbness. It can also be changes to muscle strength because those nerves control muscles and tissues. It can potentially affect organ function because as a result of these nerves being affected, they may affect the way the organs are functioning because they're also dependent on nerve activity to function properly. Activity restrictions are typically shaped around the location and the severity of the stenosis within the spine. So sometimes patients that have significant symptoms may have to alter what they're doing. Now, when we look at weight training with people that have confirmed diagnosis of spinal stenosis, and in addition, they're having symptoms as a result of their spinal stenosis, no weight training should be done unless the person has a provider that's approving what they're doing. Activity restrictions in any will always be case specific because many patients potentially could have spinal stenosis and have no symptoms associated with it. So therefore, people with spinal stenosis normally can still weight train. However, this should be approached with caution if you're experiencing symptoms as a result of the weight training, meaning if you're doing exercises or weight training and you're feeling your pain or symptoms that you have, it could be associated with spinal stenosis, you may have to modify or be more gentler on your spine as a result of it. Now, when we look at different types of weight training, what are some things that we need to be concerned about? Well, potentially anything that adds excessive compression. Now, the problem is once you're putting weight on your body and you're carrying it, you're adding compression at any level, whether it's above your head or below your head. So all weightlifting at some level adds a compressive nature to the spine. And if you have less room for the nerves in your spine and you're compressing it, potentially this is what could aggravate the issue. Now, the most obvious things would be where you're standing straight and you're lifting straight over your head. Potentially is going to cause the most compression to your body. Anything that's on your shoulders, pushing straight down on your shoulders, potentially can add more compression to your body. Sometimes if you can get a weight training in a machine that you're not so compressive, that can maybe isolate smaller groups, may be less compressive. So therefore, you may have to kind of change the exercise you're performing so it's not as compressive, where it's putting that linear downward force on your body that potentially could help you deal with the compressive nature of the activity. However, this is really important on where your stenosis is located and, of course, what symptoms are you experiencing as a result of the stenosis. Now, when we look at weight training, there are definitely benefits to lifting weights and building muscle. And this is true for patients that have spinal stenosis and patients that don't. And of course, if you have spinal stenosis and it's deemed safe by your healthcare professional, weight training can help keep your spine strong and help keep your muscles strong. And this really helps with mobility and particularly aging, because the more muscle mass that you have, the more metabolism you have, the better your body functions. And skeletal muscle is actually your largest organ in your entire body. You have more skeletal muscle than anything else in your body. So keeping your skeletal muscles strong is a very, very important concept of health and well-being. So weight training can be very important for all patients. However, when we have spinal stenosis, and especially if you're having symptoms associated with spinal stenosis, you may have to alter that, or you may have to do some exercises or some physical therapy or some chiropractic care to help improve function. Because if you can improve the alignment of the spine and help improve the function of the spine, normally you can limit the expression of the stenosis on the body and really help manage the symptoms. The first step to treating any spinal condition, especially with spinal stenosis, is determining the location and the underlying cause. Each case is very unique, but common treatments include things like exercise, chiropractic, physical therapy, rehabilitation, lifestyle changes. And of course, if symptoms don't respond well to these conservative treatments, it may involve medications. And then, of course, in severe cases, spinal stenosis may require surgery, which could be decompressive surgery of the spine. Now, weight training, we know, keeps the spine strong, keeps the muscles strong, helps keep surrounding muscles and tissue strong, helps increase blood flow to these tissues and systems. So therefore, we think weight training can be very important. But for people with spinal conditions like spinal stenosis, we have to be looking at what they're doing and potentially what could be aggravating their symptom. So therefore, their treatment and their exercise approach will be unique based upon the severity of their case, where it's located, and of course, the cause. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.